Hello, everybody. As people are coming into our Zoom room here, we'll wait a minute or two and then we'll get started. Okay, I think we'll start tonight's program. Good evening and welcome to our Zoom room as we present part one of the Siena Shares Series event, the Versatility and Value of an Undergraduate Degree in Healthcare Management. Our presenter tonight is Siena Heights University Assistant Professor and Program Coordinator of Healthcare Management, John Labriola. John has completed his BSBA from West Virginia University and MBA from the University of Detroit and has Walsh College and Oakland University for many years. He serves on many healthcare-related and community boards, including the Siena Heights University Board of Trustees. John has also held a number of administrative positions during his career, including 14 years as Senior Vice President and Hospital Director of the Royal Oak Hospital. After 40 years at Beaumont Hospital, he retired in 2010 and now lives near Charleston, South Carolina. Before we get going tonight, please save your questions for the end of the presentation in our Q&A area, and also feel free to use and follow our chat function during the presentation. At this time, I would like to introduce our presenter, John Labriola.
Thank you, Doug. And thank you to Doug and Lisa for creating the Siena Shares Series. This is wonderful. It provides Dr. Fick and I the opportunity to talk with students and prospective students about the program in healthcare. This is certainly something that is important to both of us. It also provides an opportunity to share our thoughts on a future here at Siena Heights University. I also want to thank the participants for taking their own time this evening to learn about our undergraduate program and tomorrow night for our master's program. Next slide. The environment we live in today does not make planning easy. And it certainly makes it difficult to even envision any plans for the future, especially when we are all praying for the safety of our families and for the entire community. But we must plan. We need to plan for careers and jobs. We have an obligation to be active members of the community we live in and to provide for our families. We need to select career paths that provide for not only a job, but also a career that is fulfilling and provides us with satisfaction and resources to live on. It is because of that I am so confident in the future of healthcare. It is a desirable career. Healthcare workers today have probably never been held in as high regard. We have all seen so many tributes and stories about the efforts and contributions taken by healthcare workers all over the country, not only for their skill, but also for their dedication and compassion in caring for their families and neighbors. Here at Siena, we have conducted a number of studies that conclude that we will continue to see a positive job outlook, both statewide and national, for healthcare professionals. God willing, this epidemic will pass, but the need for competent, well-trained, and prepared professionals in healthcare will continue to be there for the needs of our patients. Next slide. Next slide. Let me share a little bit about the Bachelor of Applied Science degree. At Siena, the undergraduate healthcare program is a part of the Bachelor of Applied Science degree, the BAS degree program. The BAS degree program is one of the largest at Siena. It has been successful for many years, primarily due to the focus of working with our community colleges throughout the state and advancing their graduates toward a baccalaureate degree. The BAS program is directed to practicing professionals, surgical techs, radiology techs, respiratory therapy techs, EMS techs. It is focused on the adult learner. It will help the students with coursework that they will need for continued success in their respective fields and organizations. It is an accelerated program. We offer 7-week online classes. The students in my classes are filled with staff that work in hospitals, physician offices, dental practices, rehab facilities, or surgical centers. They are professionals that work in their respective fields. They are mothers. They are fathers with families. They are our students. They are all remarkable individuals, and they're committed. And for me, honestly, it is a joy for me to work with them. Next slide. So now the healthcare management program itself. We offer a number of opportunities for degree completion. We offer a healthcare management major, a healthcare management minor. We offer concentrations in both the undergraduate and graduate business administration program. And we also offer an accelerated bachelor's to master's degree track. This is a wonderful opportunity for students. They can take 3 graduate level courses to fulfill the elective requirements as part of their undergraduate degree requirements. The classes are priced at the undergraduate rate, but they count towards their master's degree. So once the student has completed the baccalaureate program and they enter the master's program, they already have 3 of their 12 courses completed. It's just a great opportunity. So the programs are offered to help the students with their own interests and future plans. Next slide. There are many strengths of our program, but I wanted just to highlight 2. Faculty is a critical part of any student consideration. All of the faculty that teach in healthcare have had careers working in the industry as senior level hospital and nursing executives and administrators. We have 6 adjunct faculty that continue to work in the healthcare field as consultant to many healthcare organizations. They bring new ideas and practices that are being utilized in today's market. I worked my entire career at Beaumont Hospital. I was there for 40 years. I worked with staff, supervisors, department directors, nurses, physicians, but all of us are clearly understand the important role staff play in any organization in caring for the patient. That is why I and the entire faculty are so committed to teaching and working with our students to bring and to share the experiences we have all had over these many years. The healthcare management program is about management and understanding management and the conditions necessary to ensure a safe and quality and a financially sound organization to work in and provide patient care. Even if the student's personal goal is not to be a supervisor or a department director, the understanding of management is of vast importance to them. And many times I read, thank yous from the student that they have a better understanding of their organization, what their department director is going through, and they feel better about their job. So the faculty is here to help you to accomplish that. Now the curriculum. This is the curriculum for the healthcare management undergraduate program. And you can obviously read it, the prereqs, the program requirements, the cognitive requirements, and the elective requirements. If the minor is selected, the student will need to take at least 4 of the HCM courses at Siena, 21 hours in total. If the major is selected, the student will need to take 7 HCM courses, or 39 hours in total. As I mentioned, if the accelerated bachelor's to master's is selected, then the student could take 3 graduate levels as an elective. And you can see at the bottom, we have 9 hours of elective requirements. Siena has very knowledgeable advisors who can help in creating a schedule that will meet all of your needs. The specifics about these courses is their relevance. And I can speak obviously for myself and the faculty. We try so hard to make sure that the academic needs are met, but that the student has a full appreciation of the relevance of this particular, any course that you're taking to what's taking place in the marketplace. Next slide. So this is about our students. Who are they? These are their goals. They wish to pursue lifelong learning. They are continuing with bachelor's and master's degrees. They wish to advance in their careers, either in management or with their own professional positions. They wish to foster a positive and quality work environment as a leader and advocate for their patients. They wish to serve as mentors and role models in their organization. The jewels of our program are our graduates. We have them in the industry. We have them in the industry caring for patients in the community, and we are very, very proud of them. So with that, next slide. Just to say thank you. We have, as I mentioned, our advisors who are available to be able to answer questions now or in the future. That's my email, so please feel free to contact me with any questions that you may have about the program, the faculty, the curriculum, any way I could help. So I think we have some time for questions now. Doug and Lisa, if that's correct.
Yes, we do. If anybody has any questions they wanna shoot to John, let me know. John, I guess I have a question for you. I'll get things kicked off. Kind of talk about your background. Obviously, I talked about it in the introduction, but you have been involved in healthcare for a long time. Can you talk about your experience in it and how it's changed and where you think it's going?
Oh my. I think the biggest, well, there are so many changes. It's when I started, Doug, besides being a baby, it was 1970. I started as a financial analyst at Beaumont, and had the privilege of working with some remarkable people in a remarkable organization that had changes primarily due to the demographics of Detroit. 1 million people moved out of the Detroit area, moved to Oakland County, and our hospital grew by leaps and bounds, and other hospitals changed. So clearly, demographics have a lot to do with what's taking place in the industry, as is age, an aging population. So we see more and more standalone hospitals becoming part of systems. When I started at Beaumont, we were 1 hospital, then we were 3, then we were 8. And now with this potential merger between Advocate and Allina, we could be a major system in the country. And Henry Ford and Ascension and Trinity and all of them have grown. So that's been a major difference, I think, in terms of the business side of it. And clearly, I think one of the other big changes has just been technology. I listened to a Zoom meeting, a month ago or so, from the leaders at Presbyterian Hospital in New York, who were really the epicenter of the infection that took place, that hit New York City the hardest. They made reference to the fact, I guess it would have been July, that through half of the year in 2019, they had 500 telemedicine cases. And now through half of the year in 2020, they had literally thousands of telemedicine cases. So that is something that's not going to change. There will be some going back to the way it used to be, but I think telemedicine is here to stay in terms of a means of delivering care, both in terms of institution, in terms of patient or physician offices. So those are just, a couple of things. Things are just different. The size is a difference, technology is a difference, demographics is a difference, etc. So a lot of changes.
Okay. Sherry Betts, our dean, who's live tonight, wanted me to talk a little bit about career services that Siena Heights provides after they graduate, and that's a good point. Obviously, with not only healthcare industry changing, but many industries changing, short term here with the way the pandemic's hit, but also just society in general. You know, people change careers an awful lot, and I know we find that an awful lot in our college professional studies and graduate college, where people are changing courses. In fact, I have like I said, a college friend who recently went from one career to another, you know, in his early 50s. So, you know, career services at Siena Heights offers that support, you know, not only as a student, but after graduation, long after graduation. And we would invite graduates of our program to take advantage of that. Contact Sarah Kranko in our career services office. She definitely will give you some good advice and definitely help any way we can to help your career path, whether that's going back for more education or finding a job in the corporate world somewhere else. So I just wanted to emphasize the role that career services plays at Siena Heights for our students and our graduates. Leanne, I know you're joining us tonight from the enrollment side. If people don't know, maybe introduce yourself and kind of talk a little bit about the enrollment process, you know, for this program and also for both the college for studies and the graduate college.
Sure, Doug, I'd be happy to. I'm Leanne Croker. I'm the Associate Director for Graduate and Professional Studies here at Siena Heights. And I work with advisors who work with students who are going through the admissions process. And we like to talk about our model as being cradle to grave, in that when you start to work with an advisor at Siena Heights University, they will walk you through the entire admissions process. They will help you at the front end, and I'll talk a little bit more about that in a second. But not only do they help you become admitted, but they also serve in an advising capacity. And they're right along with you in your journey, so that when you're crossing the stage to get your diploma, they're there to cheer you on as well. But to get started, because I think that was your question, Doug, typically what we do for an undergraduate degree, the healthcare management degree that John described, a good approach is to connect with an advisor. We get unofficial transcripts of any education that you've had up to this point. Included in that are professional licensures that you've earned. And we also take a look at your work history and your work experience, because all of that can be combined together to create the transfer credit needed to get you in the strongest position for being able to spring forward into your bachelor's degree. We will accept up to 90 credit hours of transfer credit. And depending on which route you take within the Bachelor of Applied Science, that would mean that you would have either another 30 hours of work, 10 classes to complete with us, or in the case of the healthcare management, there are a few more hours involved, because this major encompasses both the healthcare management side of life, but also the business and the financial side of life as well. So there are a few more hours in that program. So what we do is we take a look at where you stand right now. We make sure that we look high and low for any kind of transfer credit, so that we make sure that you get the most credit for the work that you've done. And then we can kind of lay out a roadmap for you. And it's based on your schedule, what is going on in your life, what kind of a class load you can take on and still be successful with your other commitments in your life. So once we get that roadmap kind of laid out, then we have a conversation about when does it make sense to get started, and how will we do that? And again, your advisor will walk with you through that entire process. I should mention, John, you may have said this and I might have missed it. The program that John described, all of our Bachelor of Applied Science programs can be completed completely online, which means you can work school into your life. And when we talk with prospective students, that's often a question. It's like, how do I balance this along with my job and my family, especially with situations if you have children at home and that kind of thing. So it's important for you to know that this program is available entirely online. Our classes are broken into 7-week sub-sessions. So you would find that you move pretty quickly through you can progress pretty quickly through the program. you could finish the program anywhere between 4 semesters and 7 semesters, depending on which of the 2 programs that you embark on. And one of the things that we've introduced this year is our Siena Tuition Advantage, which gives students a sense of certainty about what their costs are going to be as they approach their education. Because when you get started for 2 academic years following the point that you start, your tuition won't change. And students are pretty happy with that arrangement. Doug, I'm sorry, I blathered. That's what happens when you get an advisor talking to folks.
That's okay. That's why we have you here. You're filling in the gaps on the enrollment side, so we're glad to have you tonight, Leanne. We do have a question from the audience. Ron Kohler's asking this to John. Why do you think Siena Heights is positioned well to help our healthcare students during this crazy time of the pandemic?
Well, I think for 2 reasons. Again, as I mentioned, I think the faculty and the skill set of the faculty that they bring to bring to our students, I think is very, very important. I'm not an academician by training. I spent my life in hospitals. I enjoy teaching. I think all of the faculty would say the same thing. They're not academicians by training. They all work their career in healthcare. They enjoy teaching. I think that's enormously valuable. I think that's important for the students to understand that. And again, it's not a criticism or a comment about others. I'm just saying the strength of our program in terms of really what's relevant in today's marketplace. And then I think, as I had mentioned and Leanne just went over, I think the curriculum itself, the courses are all designed to be very practical in today's healthcare environment. So we're talking to students about issues that they're dealing with on a day-to-day basis: quality, patient satisfaction, financial issues, ethical issues. So I think that those are 2 of the strengths, and I think 2 of the positions that make would make a school like Siena very unique.
Okay. John, go ahead, Leanne.
If I might piggyback off of that just for a moment, in light of the pandemic and the changes that we had, one of the nice things about our programs being online was that there was minimal disruption for our students to be able to go on through their programs. So from a process standpoint, that's an advantage. But when we all went home and we started working remotely, one of the first things that we did was we reached out to our students, and many of them were in your program, and they were trying to balance what was going on at work and balance what was going on at school and home. And initially we had fireside chat Zooms where people could just sort of check in and talk about the things that were impacting them. So we really tried to make sure that we were addressing our students on a personal level first. And then we could troubleshoot. We could see if there were patterns of things so that we could communicate to faculty and we could communicate to the administration about what we were seeing happening. And then in turn, we could try to respond to our students. So I wanted to add that because I was pretty proud of our team and then proud of the institution in the way that it responded.
Just another comment. And again, the uniqueness of the BAS program, 80% of our students are female, and the average age is 36. So when we talk about the adult learner, it's talking about working women, professionals in their field, mothers with families, and as Leanne said, the needs that they have, and they're very, they carry tremendous responsibilities. And I think that all of us try to be very, very responsive to that and understanding to that. And as I always say to my students, to me, it's like working with the staff that I would have worked with at the hospital. They're the same. That's what they're doing. They're working in hospitals. They're working in nursing homes. They're working out in physician offices, whatever. And I think all of us in the faculty understand that and try to be very responsive. Carry on the curriculum, complete the curriculum, but yet understand that so when a student writes to me and says that they've just pulled, 2 shifts or whatever, they're cut back or whatever, we understand that. We understand what they're talking about.
John, I think that's an important point to emphasize, as I keep pointing back to your past experience in the field, as a faculty member, you have that real world experience in the healthcare industry and can kind of, I guess, gauge your students. So I guess my question to you is, you've had to deal with a lot of personnel before you came to Siena as a faculty member. And now you obviously, you mentioned about the students are similar to the people you work with at the hospital. What are some of the common characteristics of your students, and has that changed since the time you've taught at Siena?
They're dedicated, they're committed. And as I said, when we saw all of the stories and tributes about the healthcare workers and what they were doing at all of the hospitals throughout the country, none of that surprised me. That's what they do, and that's who they are. And coming back to the hospital shift after shift, making arrangements at home for their families, any of us that worked in that environment can give story after story of what we experienced over the years. I have to admit, I don't know that I've ever experienced anything about what they're currently experiencing right now. This is truly remarkable. But I think they're a very, very special person. Very, very special person that works in hospitals, in any healthcare facility, I think the difference is that just the tremendous amount of pressure. That's what this virus has created for the institutions, just an enormous amount of pressure, enormous amounts of volume that are going through day in and day out. That's a big challenge.
Sure, that's a big challenge for everyone.
Mm-hmm.
Well, here's an opportunity for those still tuning in to ask any questions. John's wide open, so is Leanne. If anybody has any questions about the academic side or the enrollment side, we're here to answer them tonight. Okay, well, we answered, looks like, all the questions tonight. So again, John, thank you for leading the presentation tonight. Leanne for joining us, and anybody who's interested still on the Zoom here, the person who's on our screen, John Fick's going to be presenting tomorrow night on the graduate side for the healthcare management. So be sure to tune in for that if you're interested in learning about that part of the program. So part 1 is complete tonight. And again, thank you very much for joining us, and hopefully we'll see you next time. Have a good night.
Thank you all.